Good afternoon. Welcome to day 406 here from the St. Clair County EMA office. I'm joined by EMA Director Herb Simmons, and we're going to get right into the numbers. St. Clair County, they've tested 333,846, which is an increase of 1,479. Positive test results are 30,216, and that is an increase of 94. Those are males and females under the age of 1 up to their 80s. Some background information on that. The positive numbers also include 45 cases that were not previously reported by MedExpress Pharmacy that occurred between March 23rd and April 19th. And Director, some good members of Team St. Clair helped bring that to light.
Well, yeah, and I want to give a shout out to them. For 406 days we've been transparent, and a couple of the Team St. Clair members had contacted me and said that they had got some information that MedExpress was not reporting them. Now, whether it was a reporting error or what, but we referred them to the health department, and the health department got right on it and was able to get with the MedExpress people and get this worked out. But as you said, those 45 are from older days.
Yeah, March 23rd to April 19th, but they are being included in today's count to make sure we do have that true and accurate number.
Exactly. So thanks to the members of Team St. Clair that brought that to light, and we appreciate that. Thank you.
So continuing on, that brings our daily county positivity to 6.4%. Our negative test results are at 303,630. Deaths in the county remain at 475. For those that have completed their IDPH required 10-day isolation period, we're at 29,329. For state totals, they've tested 22,113,490. Positive test results are 1,316,091, which is an increase of 3,369 since yesterday. Sadly, the state did announce 22 additional COVID-19 related deaths, bringing the statewide death total to 21,777. For hospitalization numbers, those hospitalized in St. Clair County hospitals, there are 25 patients admitted due to COVID-related illness, and 3 of those patients are on ventilators. Regionally, there are 42 patients admitted due to COVID-related illness, with 3 on ventilators. We have no changes in our congregate living facilities, and as we talk about every day, testing is still so vitally important. If you're feeling like you have any type of symptom or you've possibly been exposed, take the opportunity to get that test done. Monday, Wednesday, Friday, and Saturday at St. Clair Square from 8 a.m. to 4 p.m. and at various pharmacies and medical facilities throughout the county. I'll now turn it over to Director Simmons for the update.
Thanks, Brian. Appreciate it. We'll go into the daily zip code report. 62201 goes up 1 to 601. 62203 goes up 4 to 658. 62204 goes up 1 to 412. 62205 goes up 3 to 664. 62206 goes up 8 to 1,372. 62207 goes up 7 to 613. 62208 goes up 6 to 1,700. 62220 goes up 1 to 2,151. 62221 goes up 4 to 2,877. 62223 goes up 2 to 1,830. 62206 goes up 4 to 3,305. 62232 goes up 2 to 929. 62239 goes up 1 to 497. 62240 goes up 1 to 175. 62258 goes up 2 to 1,092. 62269 goes up 2 to 3,374. And 62285 goes up 1 to 595. Our daily county positivity rate is up to 6.4, up from the 3.8% yesterday. The county 7-day rolling average is at 4.5, which is up from the 4.0 yesterday. The regional positivity remains at 3.1. Our surrounding counties in the region checked in today at Bond County, 2.4%, Clinton County, 1.7%, Madison County, 2.7%, Monroe, 1.1%, Randolph, 0.8%, St. Clair, 1.4%, and Washington at 2.5%. So, Brian, the numbers, and again, we don't want to alarm them. Those numbers, I'm glad we were able to tell them that. It did raise the percentage a little bit today, but understandably, we were able to explain that to them.
And you see that with the state positivity number actually having us at 1.4%. We're showing us at 6.4 because we have to include that. We're going to see a bump in the state numbers in the next couple days when that gets added in, and that's not to be alarmed. It's important that if something like this does happen, we're made aware as we were, and the health department was able to get right on it and get it rectified.
Exactly. We had 1,000 some people scheduled today for testing down there, not counting the drive-ups.
Yep.
So vaccine is definitely going on at the fairgrounds down there. We got to participate in the IEMA call today with about 100 other county representatives. We were honored to be showcased on that. They gave us the kind of the data voice for the mass fact site.
Yeah, it's kind of interesting. Early on, we decided drive-through was the way to go. From the people we talked to and just the studying of all the different sites going on, we decided drive-through was the safest way to keep everyone from additional exposures, and it's worked out very well to the point now the state of Michigan came down and reviewed it, and they're using our setup in different test sites in Michigan. It's been duplicated in Illinois in a couple places, and now today, as the spring and summer months are coming, there's other places in Illinois that are going to convert to an outdoor drive-through type as they move along. So I'm glad that we were able to make it work from the beginning. And as we talked about today, just under 100,000 vaccines have been administered at the fairgrounds in the drive-through fashion since February 1st.
Exactly. What I found interesting is when the deputy director asked, how long it took us to put it together and what playbook did we use? Because since we have done that, FEMA has now come out with a playbook that they've made available to the surrounding states. And so I told them I wish we would have had a playbook for that 2 weeks that we were putting it all together. But they actually took some of our ideas from this mass site and it's got it in a playbook. And so that's something that Team St. Clair can be proud of, that there is a model out there. Hopefully it never gets used again in our lifetime.
Correct.
But if it does, and they were impressed that we've actually got plans to add a third lane if we would need to. So it's all about being prepared. And
When we thought about opening that day one at 600 doses a day, and today our plan has the capability of 7,500 doses a day, still keeping people at about 27 minutes from the time they pull in to the time they leave. It's just amazing to see everything come together, and it wouldn't be possible without the partnerships with the health department, the National Guard, the contract
the
staffing.
hospitals, everybody. This has been a collaboration of Team St. Clair members for 406 days, and we keep saying that, and I know Team St. Clair, I hope you never get tired of hearing that because you're all a part of that, but the National Guard, we can't say enough for them. The health departments, both the East Side Health Department, the St. Clair County Health Department, our law enforcement people that are down there, keeping the traffic flowing smooth. It's just a well-oiled machine. There's no reason the St. Clair County Transit with the shuttles from the Shield Station back and forth. It's just been a great organization, operation. We got a long way to go.
Yes, sir.
But we can get there a lot quicker if you're eligible, 16 or over. There's no reason why you just don't go down there. Don't need an appointment. 9 to 5 every day but Wednesday.
Yes, sir.
Wednesday we do housekeeping.
Yeah, time to clean up, fill some potholes, and
And we
get
can't forget about the health of the highway department.
they have been instrumental.
They sure
When we
have.
sat there and worked through today, the amount of rock and time and effort they put in to keep that. And some people that have been through there have mentioned, the only bad thing was the potholes. And if that's the case, fantastic, because they've done everything they can to keep that site in tip-top shape with the freeze and the thaw and the rain. And it's been a learning experience for everybody involved.
So the moral of the story that we're talking about is there's no reason why, if you've been waiting to go get your shot, the health department at the fairgrounds is the simplest, easiest way. You can either call the call center or make your appointment, or you can just drive down there and get roll up the sleeve and get the needle in your arm, and you can be a part of that solution. And then we can all try to get back to some sense of normal, whatever that's going to be. Speaking of back to normal, we're going to be back here with Cindy in just a few moments to translate this into the Spanish communities, and then we'll be back tomorrow for day 407. Everybody have a good evening.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently, however, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.